Hi, doctor.
Hi.
What inspired you to pursue your career in plastic, reconstructive, and cosmetic surgery?
So my passion was surgery. So after I have finished my MBBS, I have done general surgery. After finishing my general surgery, then the option of super specialization has come. When I have gone through all the branches, I felt plastic and reconstructive surgery is the complete surgery for me, because here we do everything from head to toe, from hair transplantation, arm transplantation, replantation, whatever is possible. I thought this will be a complete surgery for me.
Can you tell us about the mission and vision behind founding Pratap Hospital?
I have done my MCH plastic surgery in Safdarjung Hospital, New Delhi. So many general people are not aware. It is the largest central government hospital in India, and it is in fact the world's largest burns and plastic surgery institutes. So having done there, when I came to Andhra Pradesh, I have started initially in NRA Medical College, where I started the department of plastic surgery, and I have established the department, and I am the professor and head of department there. So then I thought I wanted to set up a complete institute of plastic surgery, which includes cosmetic surgery, replantation, everything under one roof. So with that mission, I started this 100-bedded of plastic surgery hospital.
What makes Pratap Hospital different from other plastic and cosmetic surgeries in Andhra Pradesh?
In a sense, it is that there are no dedicated plastic and cosmetic surgery hospitals in Andhra Pradesh. There are very few of them. Generally, what happens is plastic surgery is a branch in a multi-specialty hospital. Like imagine there is a plastic surgery branch in Apollo Hospital, in Manipal Hospital. Whereas Pratap Hospital is basically a plastic and cosmetic surgery. That means here, our core focus is on plastic and reconstructive surgery. Other departments, we may take their help for some cases, but ideally, when we built it, nearly this 50 to 100-bedded hospital is meant only for plastic and cosmetic surgery.
What is the biggest misconception Indians have about plastic surgery?
So, because of media playing a role, or people being media hungry, etc., people generally equate plastic surgery with cosmetic surgery. Cosmetic surgery is a very small part of plastic surgery. Plastic surgery has many departments. For example, burns. From the time of admission till the time of discharge, burns completely comes under plastic surgery. So many people don't know that. Same thing, cleft lip, palate, or hand replantation. If somebody undergoes a hand injury, hand needs to be replanted, finger needs to be replanted. This is all pure plastic surgery. But generally, because there is not too much awareness about this, people only want to hear about liposuction, hair transplantation. So people think plastic surgery is only cosmetic surgery.
How do you help patients set realistic expectations before undergoing a cosmetic or reconstructive procedure?
So it's a very tough question, in the sense that people, when they come to us, they're already misled. They go through in the present time, false social media campaigns. They come to us with very heightened expectations. It is very hard for us to satisfy a patient with very heightened expectations. So we always try to bring the reality to them. We always try to undersell ourselves. Suppose if I can build a 4-story house, I will promise them only a 3-story house. There is no point in promising 5-story house and doing 4-story house and getting scolded for it.
Yeah. How do you ensure the highest standards of patient safety and care? And can you share a memorable patient transformation story?
Any one memorable in the sense, I have done more than maybe around 8,000 to 10,000 surgeries completely, whole plastic, cosmetic, reconstruction, everything. So when I came here in 2013, one thing I can tell is 2015, I think. So I got a late evening call about some lady who's met with an accident and whole upper limb has come out. So the whole upper limb up to here has fallen on the road in a road traffic accident. So the doctor from Tadepalligodam, he knows that I do such things. So he called me. I said, I'm available. Please send the patient. So the patient came to us at, I think, around night 10:30. And then we started the surgery and finished at morning 6 o'clock. Took a gap of 6 hours. Again in the morning, we started around 11 o'clock. Finished at 3 o'clock. And that is the first successful above elbow replantation in the state of Andhra Pradesh and even in Telangana. I think, to the best of my knowledge, even till to date, we could not do again any other above elbow replantation. We have done many below elbow replantations. In our institute at present, every month we do at least 2 to 3 finger replantations. But that is the first and maybe the only one above elbow replantation till now in Andhra Pradesh and Telangana.
What are the most common procedures you perform, and how have recent technological advancements changed the way you perform surgery and improve patient outcomes?
Routine, for example, in a week, routinely what commonly we do are liposuction for abdomen, etc., and gynecomastia and hair transplantation. These are the most common cosmetic surgeries we do. Botox and fillers for the face, for the lip or for the nose, etc., are the most common non-surgical aesthetic procedures that we do other than lasers. Coming to the reconstructive part, hand injuries, hand surgeries, burns are the other common things we do.
Have you ever treated a patient whose life was completely transformed through reconstructive surgery?
Yes, I have treated a patient with 90% burns and he survived. He is one of the few in whole India till to date who has survived with more than 90% burns. The good thing criteria when I look back why he survived, why we are not able to salvage many others is this patient was young. He's only around 21, 22 years. So the age was on his side, number one. Number two, from the place where he got this burns injury, our hospital was very near. So he was able to come to us within 1.5 or 2 hours after the time of injury. From then he was there with us nearly 3 months, and luckily for us, we were able to survive him, salvage him and send him home. He ended up requiring multiple skin grafting surgeries, etc. But anyway, he has a long life ahead of him. Hopefully, we wish him well.
What does the future of plastic surgery in India look like over the next 5 to 10 years?
So basically, doctors follow money, or any other medical field follows money. Where there is a lot of money, lot of medical companies do research, etc. Now people are willing to spend a lot of money on aesthetic needs. So generally, people who have money, they can put money, extra money, save money for cosmetic requirement. So a lot of research, investment is going towards aesthetic fields. Now we are having hundreds of new laser machines coming for skin brightening or for skin tightening for different reasons, and even for liposuction also. Previously we were having only one type of manual assisted liposuction, then came suction, then came power, now we are doing laser assisted. So companies are investing a lot of money for research, and doctors are also buying a lot of equipment, because we are able to get the money back because patients are willing to spend. Let me give you an example. You'll be surprised that in my hospital, that amount of money I have spent on liposuction machines is more than 1 crore rupees. Imagine one single center, one single plastic surgeon, he spent more than 1 crore rupees only on liposuction machines. Imagine, that means people are willing to spend. I'm getting my money back, so I'm willing to put some more money for it.
What impact has your 3 best rated listing had on your business visibility and customer trust?
I'm not 100% sure, but I have a couple of patients who came to me after they heard that I'm the top rated in the 3BestRated website. But for me, the most important thing is that I was there top rated by them since 2013, since I've started my practice in Vijayawada, I think. And they don't charge any money. So they do a proper survey and they give it to the best rated. So they don't approach us and neither do we approach them. So in that way, I think they're a genuine company.
Thank you so much, Doctor, for your inspiring conversation, and congratulations, sir, for being rated as top plastic surgeon in Andhra Pradesh.
Thank you.